it's very hard to access a good sleep physician. There are only 7,000 of them for 70 million plus Americans with sleep issues. And, even for the sleep physicians themselves, it's hard to administer and monitor CBTI. So we've sort of created solutions around that to really help practitioners, or even the folks who can't access practitioners, build better sleep hygiene.
Yeah. Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster, with my guest today, Sunny Liang, CEO and co-founder of Zen Sleep. Sunny, great to see you today.
Great to see you again, Logan. How you doing?
So Zen Sleep, everyone needs better sleep. I need more sleep. It seems like an appropriate thing to be talking about anytime. How did you get into sleep science?
Yeah, Logan, it's really personal to me. I'm a lifelong insomniac, and I used to work on Wall Street. I was a banker, private equity investor for a couple of years, and it just got to the point where I wasn't sleeping, maybe 2 or 3 hours at best. I was living off of caffeine, and finally saw a sleep doctor a couple of years ago, and was introduced to cognitive behavioral therapy for insomnia, or CBTI. And it's the most proven clinical scientific solution to help people with insomnia like myself. And that really helped change my life around. So I wanted to take that experience and really create something to help more people like myself.
Okay. What is cognitive behavioral therapy for insomnia? Kind of walk us through what some of the tools are.
Sure. Yeah, Logan, it's just basically CBTI for short. Probably heard that name around quite a bit the last couple of years. Matt Walker talks about it in the book Why We Sleep. But it's basically a way of helping people sleep better through non-invasive solutions, right?
Okay.
So you have to understand concepts like circadian rhythm, sleep debt, right? And it's not rocket science, but it takes a little bit for people to understand their relationship with caffeine, with alcohol, for example.
Okay.
I'm a big tea drinker. My family makes tea, and growing up, we used to drink a lot of tea. And then I realized, wow, the caffeine in the tea was actually keeping me up at night. And
Okay.
I needed to cut that off earlier on enough for my body to naturally release melatonin. And, taking a nap in the middle of the day, although LeBron James might do it sometimes before a game, it's probably not suitable for most of us, right?
Yeah.
Because we're not burning as many calories as he is. So that's really the science of coaching you and teaching you how to better your sleep hygiene.
Okay, sleep hygiene. So what I'm hearing is that it's kind of some logical, practical steps that you can take versus someone says, oh, now I need pills. Now I need medication. Now I need Ambien or whatever it is. So it's like all this sleep hygiene. Okay, so you were an insomniac. You got help. You learned about CPTI. Now take me to Zen Sleep. When did you decide, okay, now I'm going to turn this into a platform?
Yeah. Logan, it was about 2.5 years ago. I was wrapping up my second job in the startup world, and just kind of woke up one day and thought, hey, let's give it a shot, right? And it's personal to me because I lost my grandmother a couple years ago, and she was on sleeping pills, like you said,
Oh, really?
for 25 years.
Wow.
And it's a big issue, right? These things are really bad for your health. They're what we call sedative hypnotics that shut your brain off. 8 out of 10 people on sleeping pills should not be on sleeping pills.
Yeah.
So that's something that I was always very passionate about. And I just saw a massive opportunity in the market where, it's very hard to access a good sleep physician. There are only 7,000 of them for 70 million plus Americans with sleep issues. And, even for the sleep physicians themselves, it's hard to administer and monitor CBTI. So we've sort of created solutions around that through the app, through our new dashboard, to really help practitioners, or even the folks who can't access practitioners, build better sleep hygiene.
Yeah. How have you dealt with the issue that people know they need more sleep? They need more sleep. They know they need more sleep, and yet they don't treat it like a health issue. They don't address it the way that they should. So it seems like, okay, the challenge is clear, the market is giant, and yet, am I right? People don't address it the way that they should. So how do you bridge that gap with a product?
No, that's a great point, Logan. And unfortunately, people try to address it with pills, right? A lot of PCPs and general practitioners just say, hey, you can't sleep, here's some Ambien for a couple of weeks. And that's how, unfortunately, my late grandmother was on it for 25 years. So what we're doing here, and for anyone that has had the chance to look at Zen Sleep, we're really that sleep coach in your pocket. We send you reminders, we track things, we give you little rewards. And what we're talking with insurance companies now and employers and bigger organizations is actually creating a reward or gamified system.
Okay.
Aetna did this a few years ago with their own employees, and I think it was, they showed that they slept on average 7 hours on average per day per month. They got like a $25 bonus. So
Okay.
we're letting our employer partners, our insurance partners say, hey, let's bake a little bit of incentive into this, right?
Okay.
And people start feeling that need of like, okay, I know it's good for my health, but there's a little bit extra. I think that's the key to behavioral health.
How much can you quantify getting just an extra hour of sleep, the benefits of getting an extra hour of sleep if you're working with an employer?
Yeah. So it's about $3,000 per employee per year in
Okay.
cost savings and productivity benefits. There are a couple of NIH studies that were done the last couple of years that really quantified this. And
Okay.
the one I'm quoting right now is done by Harvard, actually, about 2 years ago. So I think post-pandemic, we really realized the importance of health and recovery and sleep. And I think there's a lot more science around it. There's a lot more work that needs to be done. But as an insomniac myself, I can tell you, if I get my 7 or 8 hours of sleep, I feel miles better than getting 4 or 5.
Do you still struggle with? You still have to be pretty careful about your sleep hygiene.
Yeah, absolutely, Logan. It's I've talked a lot. I got to walk the walk if I talk the talk.
Yeah,
So
yeah.
I've been using my own app for last year, and it's really helped. I think one of the key issues that people understand it, right, but they forget to do it. And one of the things that we do is just we're sort of that assistant that's with you 24/7. So I had a fellow investor the other day said, hey, now you're a founder, you must not sleep much. I said, well, in fact, I actually have been sleeping pretty well. I better talk the talk, right? So and walk the walk. So it's been good, but insomnia, and I tell people this all the time, it's not something you completely cure, right? It's something that you're gonna have to learn to deal with, learn to better over time, but it's definitely manageable.
Yeah. Okay. Talk about the product. Obviously, you've got your platform that helps you with sleep hygiene. I'm guessing it's reminding me to stop drinking coffee. It's reminding me some of the best practices. Talk to me about kind of elements of the platform, features that you're excited about in 2024.
For sure, yeah. I think the big one that we announced recently was our new GPT AI assistant.
Okay.
And we just launched on the ChatGPT store. So if you guys look up Zen Sleep Coach. We actually spent the last couple months training a coach, an AI coach, based on all of our logic, our data, and our understanding of sleep science, and it can really help people. So for any folks that are interested, check it out on the GPT store. It's also on our app, so that's a great first line of defense for people struggling with some early issues. But the product still remains the same, Logan. It's that assistant that's with you. We send you the reminders. We connect with your wearables, whether you have an Apple Watch or Whoop that I'm wearing right now. And we show you the real data. We show you the real improvements that you're making.
Okay. So just so I understand the GPT coach, you're like an early adopter here. This is something they rolled out pretty recently that you can kind of create your own, right? Put it on a store. Yep. So people maybe were using ChatGPT to just ask questions about sleep, and now you are supplying the sort of evidence-based, back end, so there's fewer hallucinations. Is that the idea?
Yeah. Basically, we trained this coach to basically mirror what one of our coaches or a good sleep physician would ask and respond to, right? So if you ask our coach, they'll ask you, hey, what, are you having trouble falling asleep, waking up? What are your habits? Has anything changed? And we really start narrowing down from there. So it's we're all in awe, actually. 18 months ago, I would have said, this thing's years away. But
really?
Over the last couple months, as we've trained this model, it's really been shocking in a good way for us.
Yeah.
And I think that's going to open a lot more doors and help us scale, right? Having this ability opens the doors up for a lot more people at a much lower cost. And it really is in line with our mission of helping people that can't get access to good sleep health.
Yeah. You talked about working with employers and having financial incentives, gamifying it, which kind of ties into my question about how do you get people to really take their sleep seriously at scale, because they just ignore it. They even take it as a point of pride that they don't get sleep, right? So I'm just curious about how you deal with that. Yeah, how you deal with that at scale.
Yeah. No, look, to your point, I used to be a banker, and one of the funny things that we always compared was, hey, how little we slept, how many hours we worked.
Yeah, it was a point of pride.
Like a badge of honor. And I think, thankfully, the narrative's shifting around that. Kobe Bryant had a great video with Ariana Huffington a few years ago where he talked about his discovery of the importance of sleep, and that was how that was actually harming his performance the less he slept. So I think to your question, that's the question we're still asking ourselves, right? We're starting small. We're working with the physicians, the sports teams. Recently signed up a notable state university to help their swim team, their student athletes sleep better. So we're starting small, but really our goals are big, right? Going through big insurance companies like United Health, Cigna, that cover tens of millions of Americans, right? Eventually going through Medicare and Medicaid. I think that's the scale, that's the level we want to get to. Because we believe that everyone deserves a chance of building sleep. And as you mentioned earlier, sleep is the root cause for a lot of health issues down the road. And I've seen too much of that too close to myself, former colleagues in the finance world especially, aging probably much quicker than they should, having heart attacks. And it's sad to see that, but there's really a solution around it, and we need to take it more seriously.
I feel like maybe there's a cultural tide shifting. I believe there was a Super Bowl ad for the Apple Watch about sleep hygiene. Do you remember this?
Absolutely.
And I saw that. I thought of you, and I thought, there's something shifting here. Here's this person like really thinking about sleep hygiene. So I hope that's the case. We all need our 7 or 8 hours.
Yeah.
I happen to be married to somebody who is very vigilant, and so she's helped me.
It's fantastic.
And I'm a better human being for it. I hope she watches that. But Sunny, thanks for stopping by, give me an update. I love that you're building off of your own passionate personal experience, helping people get a good 8 hours, get a good 7 hours, whatever is good for them, and bringing the best technology to bear. So best of luck in the next year.
All right, thanks, Logan. Really appreciate it.
All right, thanks for coming by.
Thanks, sir.